We have two panelists tonight. Dr. James Gordon. I've known Jim Gordon for a long time, ever since we were children together and had a full head of hair, and you can see that's now gone. Dr. Gordon graduated from the Northwestern Feinberg School of Medicine and is an infectious disease specialist and affiliated with DMC Huron Valley Sinai as well as Beaumont Health. And the reason he's here tonight is not just because of our friendship, but because he is going to teach us all about what's going on with COVID, infectious disease, and how it relates to us and our health and well-being. As well, we have Dr. James Grant, graduate of the Wayne State University School of Medicine, anesthesia training at Northwestern University Medical Center. It seems like Northwestern likes to train a lot of people. And now the Chief Medical Officer at Blue Cross Blue Shield of Michigan. And the reason Jim is here tonight is because he is well-versed in understanding all about healthcare, particularly when it comes to understanding how the insurance industry and the community and bringing it all together to make it something that all of us can try and absorb and understand how we're going to move forward beyond the pandemic and apply healthcare to us and our community. The COVID pandemic had a lot of effects. Statistics show that over 25 million screenings were not performed in 2020 as a result of the COVID pandemic, and 80,000 cancers were not diagnosed in 2020, 20,000 of them being prostate cancers. These cancers did not occur, but they did. And people have these cancers and are not diagnosed with them and will be delayed in their diagnoses and will probably have later stage disease. And so we need to convince men that now that the pandemic is on the other side of the mountain, we need to start looking at getting back into our routine healthcare and screenings. So delayed or absent healthcare is not an option, and we need to get back in the fold and convince our men to get back into their healthcare opportunities. The one thing I'm really concerned about is a long-term pandemic hesitancy. And that's something that we'll be talking to the two physician panelists about tonight. And I think that understanding the psychology of what has happened and how we get beyond it is really going to be an important part of our discussion this evening.